Hi, my name is Dr. Hsieh Wen-Son, and welcome to Ask Dr. Icon. Today we have some questions that on head and neck cancer that we were asked on Facebook, and I'll be answering those questions today. The first question is, I have some swollen lymph nodes in my neck for a few months. What type of test should I do? I think in order to answer that question, it's important to remember that most of the time swollen lymph nodes are in fact due to infections, and that only a minority of swollen lymph nodes are in fact in the end due to cancerous growth. So one of the things that we want to make sure is that we understand the history of these swollen lymph nodes. So swollen lymph nodes that grow up and then shrink again are very unlikely to be cancerous in nature. But lymph nodes that are persistently enlarged for a period of time, like a few months, and that are associated with certain other symptoms such as a sore throat that doesn't heal, bleeding in the nose or mouth area or coughing up blood, pain with chewing or swallowing, pain of any kind or a lump in the mouth or neck area, ongoing sinus infections, ongoing blocked nose, headaches, patches of white or redness in the mouth area, such as the tongue, lining of the mouth or gums, loss of senses as smell, having double vision or difficulty hearing, weight loss that cannot be explained by diet or exercise. Then, in combination with those symptoms, swollen lymph nodes are more concerning for the possibility of cancer. Therefore, we would then want to do more testing. So testing can involve, number one, either ultrasound or CT scan to look at the nature of the lymph nodes, how big they are, how many there are, and whether they look suspicious or not. But the definitive test to tell whether a lymph node is in fact cancerous or not would be a biopsy of the lymph node. And another question that's related to that is, when should I do a biopsy if I have a lymph node that's swollen in my neck? And is there a size at which it becomes necessary to do a biopsy? Again, as we talked about above, there's not a size at which the lymph node is definitely going to be cancer. The history is still very important. If a lymph node grows and then shrinks again, then it's very unlikely to be a cancerous growth and more likely to be something that's reacted to an infection. But if a lymph node pops up, is swollen, and doesn't go down in size, and then is associated with certain other symptoms that we outlined before, then it's more likely to be cancerous and it needs to be biopsied. And the next question that we'll be addressing are, what are the treatment options for head and neck cancer? There are many very good treatment options for head and neck cancer at this point, and the best treatment options depend on the extent of the cancer, the disabilities that may happen as a result of these treatments, as well as the overall medical condition of the patient. Surgery is a major cornerstone for treating localized head and neck cancer, and chemotherapy and radiotherapy can be used to reduce the risk of recurrence after surgical resection of head and neck cancers. Sometimes chemotherapy and radiotherapy are used to treat head and neck cancers which are not resectable, or where resection causes too much disability to the patient. Some of the biggest advances in the treatment of head and neck cancer are targeted treatments that we now use together with either radiotherapy or chemotherapy in order to improve the outcomes for treatment of head and neck cancer. For example, one of the targeted therapies, such as cetuximab, can be used in conjunction with radiotherapy to improve the outcomes of treatment of localized head and neck cancer, which cannot be treated with chemotherapy. Immunotherapy has resulted in significant improvements for a subset of head and neck cancer patients with advanced disease. When combined with chemotherapy, immunotherapy for certain subsets of patients can improve the response rate in terms of shrinking the tumor, as well as improving the duration of response in terms of the period of time with which the tumor is under control, resulting in better outcomes for patients, resulting in better control of symptoms, resulting in a longer period of control, and resulting in a longer lifespan for patients with otherwise incurable metastatic head and neck cancer. And this is also achieved at relatively low toxicity rates and for these patients. So drugs like these, such as pembrolizumab or nivolumab, are very useful and are a cornerstone of our patients for treatment of head and neck cancer today. Okay, thank you for your questions. If you are experiencing any of the symptoms that I've mentioned just now, do visit your doctor for a consultation. Thank you and have a nice day.